Hey everyone, welcome back. Today, we're going to be taking a deep dive into the world of medical data. And we're going to be looking at this new research paper about this thing called LLMD. I'm sure you've all heard of large language models, things like GPT-4. Well, LLMD is a little different. It's built specifically to try and make sense of medical records. And that's no easy task. So we're going to dig into how this new model works, how it stacks up against the competition, and I guess most importantly, like why this even matters for healthcare in the future.
Yeah, and it's really a fascinating story because you see, unlike a lot of these other AI models that are trained on, general medical knowledge from textbooks and things like that, LLMD has gone a step further. It's been trained on a huge, like massive data set of actual real patient records. So think electronic health records, scanned paper documents, all of that. And this gives it a real edge because it's able to understand the messiness, the complexities of how medical information is actually documented in the real world.
Yeah, it's one thing to be able to, spit out medical jargon,
Yeah.
but it's another thing entirely to understand the context of all those records, right?
Exactly.
Because medical records, let's be honest, can be kind of a mess sometimes.
Oh, absolutely. And the paper actually highlights this with a really striking example. They talk about a study where they found that something like 30% of patients with hemophilia had conflicting diagnoses across their medical records.
Wow.
Which is a pretty scary thought when you think about it, right? That really underscores the need for a tool that can connect the dots and give doctors and researchers, really anyone who needs to look at this data, a clear and longitudinal understanding of a patient's health.
That is a bit of a head spinner, I've got to say. Conflicting diagnoses for the same patient. So, okay, how does LLMD actually tackle this challenge? Like, what makes it different from, say, just feeding a ton of medical textbooks to a general purpose AI?
Yeah, that's a great question. And the answer lies in the training process. So LLMD, it goes through this really interesting multi-stage training process. It starts with what they call continued pre-training. So essentially, they take a really powerful foundational language model, similar to, something like Llama, for example, which I'm sure many of you have heard of. And they don't just train it on general medical knowledge, but also on this massive data set of real patient records that we've been talking about.
So it's getting like a crash course, I guess, in both, the medical lingo and then also how things actually work in the real world.
Exactly.
How doctors actually write these things down.
It's getting a taste of the trenches. And it doesn't stop there. LLMD then goes through this really rigorous training on some very specific tasks, what they call structuring and abstraction tasks. Now, structuring, you can think about that as like teaching the model to identify the core building blocks of a medical record. So things like, different sections of a document, identifying medications, lab results, and then importantly, aligning those with standard medical ontology. So it's all nice and organized and standardized. Figure 2 in the paper actually gives a really nice visual representation of this whole workflow.
So it's learning to kind of break down those records into their core components, sort of like organizing a jumbled toolbox.
Precisely. But the real magic, I guess you could say, happens in the next step, which is the abstraction part. So this is where LLMD really goes beyond just, identifying those individual pieces. And it starts to actually understand the relationships between them, kind of like, a human clinician would, right?
Okay, so if we're sticking with our toolbox analogy, if structuring is like organizing the toolbox, then abstraction is like, I don't know, understanding which tools you need for a specific job
That's a great way to put it.
and how to like use them together.
Exactly. So for example, LLMD can figure out things like when a patient started taking a certain medication, when they stopped taking it, maybe even the reason for stopping. And it can even flag any potential like contradictions or ambiguities in the records. So, maybe a doctor's note says one thing, but then a lab report seems to suggest something different.
Right.
LLMD can pick up on those discrepancies.
It's really starting to sound like LLMD is developing like medical intuition or something. It's connecting the dots to create this, bigger picture of a patient's health journey.
Yeah, exactly. I mean, that's really what we're striving for here, that longitudinal understanding of a patient's health. But of course, the big question is, how do we know LLMD is actually up to the task?
Right, because it's one thing to see, all these impressive, diagrams and stuff in the paper,
Yeah.
but we need to know how this thing actually performs compared to other language models out there.
Absolutely.
Both, the general purpose ones, and then also the ones that have been specifically designed for, medical applications. So did they put it to the test?
They did. They used two main evaluation methods to assess how capable LLMD actually is. One is called log probability scoring, and the other one is text response scoring.
Okay, so walk us through those. Like, what do those scoring methods actually tell us about LMD's performance?
Sure. So log probability scoring, basically, it measures how well a model connects medical concepts. So, for example, if you give the model a question about a patient's symptoms, does it rank the correct diagnosis higher than other possibilities?
So it's like giving it a multiple choice test on medical intuition.
Exactly. And then text response scoring, that evaluates the model's ability to generate accurate and coherent answers to kind of more open-ended questions. So similar to what, a doctor might encounter in a real-world setting,
Hmm.
where they're not just, choosing from a list of options, but they actually have to formulate a response.
Right. So it's like the difference between, passing a medical exam
Yeah.
and actually being able to like explain a diagnosis to a patient in a way that they understand.
Exactly. That's a great way to put it. And what's really interesting is that they found some models that perform really well on log probability scoring. They ace the multiple choice test. But they don't necessarily do so well when it comes to generating those more nuanced text responses.
They freeze up during the patient interview.
Exactly.
How did LLMD do? Did it manage to kind of strike a balance between those two?
Yeah, it did actually. In fact, it actually exceeded expectations, particularly on the text response front. Figure 7 in the paper actually shows LLMD's performance on a benchmark called PubMed QA. And it's really impressive. Even a smaller version of the model, which they call LLMD 8B, achieved state-of-the-art accuracy for those text responses, even surpassing some much larger models.
So it's not just about size, it's about that specialized training. It's about really understanding the nuances of those medical records.
Exactly.
But, benchmarks are one thing. How did LLMD actually handle the messiness of, real medical records in practice
Right.
when it's not just a carefully curated test set?
That's where LMD really shines. So they actually tested it on a bunch of these real-world tasks that they kind of pulled directly from their production data,
Right.
focusing on those, structuring and abstraction skills that we talked about.
So like real medical records with all their quirks and inconsistencies and, that's the
Exactly.
ultimate test.
Absolutely. And as you can see in Figure 7, LLMD significantly outperformed all the other models that they tested, really demonstrating its ability to navigate the complexities of those real-world medical documents.
No, that's what I call a real world advantage. But, let's be honest, no AI is perfect, right? Were there any areas where LLMD struggle or maybe showed, some room for improvement?
Yeah, absolutely. I mean, there's always room for improvement, right? One area where the researchers acknowledge that there's ongoing work to be done is with what they call long tail concepts. So these are like rare medical terms or conditions that just don't show up as frequently in the training data.
Right. So it's like trying to, I don't know, learn a new language, but you've only ever been exposed to like the most common words. You might be able to, order a coffee and ask for directions, but good luck discussing like advanced physics or something, right?
Exactly. And the paper actually uses the example of this rare blood disorder called PNH. It stands for paroxysmal nocturnal hemoglobinuria, but yeah, PNH is easier.
Yeah, much easier.
So because PNH is so uncommon, the specific lab tests that doctors use to actually diagnose it and monitor it, those aren't as common in the data either, right? So this presents kind of a hurdle for LMMD. Similar to how, even a human doctor, if they encountered a patient with a very rare condition that they weren't familiar with, they might need to, consult some specialized resources or do a little more research. And Table 4 in the paper actually lists some of these rare PNH lab tests.
Okay, so how do you like teach LLMD about these medical zebras, so to speak, these rare cases that, are so crucial to get right?
That's where something called targeted data augmentation comes in. So they can basically tell LMD, hey, pay extra attention to these rare tests, these rare conditions, and they can feed it more examples, give it more to learn from.
So it's like creating like flashcards or something for those less common medical terms,
Yes.
helping kind of, expand its vocabulary.
Precisely. And it's not just about, rote memorization either. The researchers are also working closely with actual clinicians, human doctors, to fine-tune LLMD's understanding of these more rare cases and make sure that it can, really make those connections and provide useful insights, even in those areas of medicine that are, a little less charted.
Right. So it's like having a team of specialists on call,
Okay.
ready to like guide LLMD toward
Mhm.
becoming this, truly well-rounded medical expert.
Exactly.
But okay, this all kind of begs the question, what does this actually mean for the future of healthcare? Like, are we all going to have AI doctors soon?
Well, I wouldn't say we're replacing human doctors just yet, but, LLMD, it's more like this powerful ally. It's a
Yeah.
tool that can really enhance, I think, and augment what healthcare professionals are already doing.
Right. So it's about empowering both the doctors and the patients
Exactly.
with better information.
Exactly. I mean, imagine a world where, patients have access to a tool that can summarize their entire medical history for them, point out potential red flags that they should discuss with their doctor, maybe even help them, formulate more informed questions during their appointments.
Yeah. Talk about putting patients back in the driver's seat of their own healthcare journeys.
Exactly. And then from a research perspective, you know, think about the possibilities of, being able to analyze clinical trial data more efficiently, maybe uncover hidden patterns that we haven't noticed before, accelerate the development of new treatments, especially for some of these rare diseases where, you know, every data point is so precious.
Yeah.
It's really incredible.
It's like hitting fast forward on medical breakthroughs, all thanks to this, deeper understanding of patient data.
Exactly. And I think the most exciting part is that, we're really just scratching the surface here of what LLMs like this are capable of. So as this technology continues to evolve, I think the possibilities for, truly personalized medicine, proactive healthcare, they're really remarkable.
Yeah, it's both incredibly exciting and also a little bit mind-boggling to think about. But that's all the time we have for today's deep dive. But we'll keep our eyes peeled for any more exciting developments in this space. So until next time.